Sandoval. Thank you for joining us first off. If you could, tell us about this program. It's so exciting.
Yes, well, thank you very much for the question. So the program came to me. It was my baby project idea that I wanted to be able to educate people on health. My first thought was like, let's make a whole half an hour of clinical research. But now that I've learned, it's boring. To us in the field, half an hour of research talk is amazing. But to the layperson, that's too much. So we decided to, I had a friend who's a very well-known news anchor sit down, and he's like, Fabian, it's a great idea, but we need to come up with a better strategy. So we came up with a strategy to say, okay, we're going to pick one topic and dissect it. And that's what I did. Once we came up with the idea, we started to come up with content for it. And basically, it's a half an hour show that will take one disease and talk about it through its entirety. So we'll say asthma. So how does asthma affect our community, right? Well, it also affects lower economic patients. Poverty has a lot to do with, like I said, how you live, how you eat, what you do. So asthma. Then we talk about community and asthma. So then that's a segment called community health. So in the community segment, we talk a little bit more about, we give statistics, we give signs and symptoms. Then there's another segment called advances in medicine. And that's where I sneak in clinical trials. So I call it advances in medicine. And they say, this is the way we normally do our treatments. This is the way medication normally works in this pathway, right? So I teach a little bit of anatomy because I want people to understand how it works. And they say, okay, so now you learn the basic anatomy, how it works. Let me show you how this new medication, this new device is working. And why is it different? And why we need to participate.
Talk about the title of the show and why is it important to talk to people in Hispanic markets and underrepresented markets? Why is it important to educate them about clinical trials and other aspects of healthcare?
Yes. So, Tu Salud, Tu Familia, your health, your family. We want to make sure the families are engaged in it. If the mom and dad know what's going on, they're going to take care of the kids. I've had a little girl who was 13 that watches the show with her grandma. So it's really sweet. So that's the value of the show. And the important reason why the show has gotten so much of an impact is because our communities don't know what clinical trials are, don't know what types of conditions are out there, don't know what diseases affect the Hispanic community, right? There's a gigantic gap in health knowledge. The health literacy has to get closed. We love what we do. We were doing it right. We were showing people what it was. And that really made a huge difference. I'm extremely proud to say that maybe as of now, I am the only kind of research scientist, clinical trials person that has won 2 Emmys on a TV show that came up out of nowhere. And the other thing is that it's thanks to our sponsors who saw the vision, the work that we have done with my team. That has put this together. Our producer, Andrea, has been fantastic. We've got a great camera guy, great sound, my co-host. Just 4 of us. 4 of us have made the show. We have 2 Emmys to prove it.